আজকে আমি হয়তো ইংলিশ বাংলা মিলাই কথা বলবো। আমার প্রধান মোটিভেশন যে বাংলাদেশের তরুণদের সাথে একটু কানেক্ট করা, স্পেশালি যারা সিভিল সার্ভিসে যেতেন পলিসি মেকার্স, তাদের সাথে আমার একটু কানেক্ট করার পরে ইউনিভার্সিটির সাথে শিক্ষক ছাত্রছাত্রীদের সাথে অনেক কানেকশন আছে। I would really like for us to then bridge the gap between evidence and policy making. আজকে আমি একটা গল্প বলবো, একটা লম্বা গল্প। সেটা হলো যে এই গত 2 বছরে যখন কোভিড আরম্ভ হল মার্চ 2020, তো তখন থেকে এই বাংলাদেশ গভর্নমেন্ট সাথে অন্যান্য কয়েকটা দেশের গভর্নমেন্টের সাথে খুব ক্লোজলি আমি কাজ করছি। তো সেই গল্পটা প্রথমে মার্চ মাসে 2020 মার্চে আমাদের চিন্তা ধারণা কিরকম ছিল, কি ধরনের কাজের প্রয়োজন ছিল, তারপরে 2020 কি হলো, 2021 সালে কি হলো, যখন ইন্ডিয়ায় বড় ক্রাইসিস হলো, তখন আমাদের চিন্তা ধারণা কিভাবে চেঞ্জ হলো, আর এখন কি করা প্রয়োজন সেই পুরো গল্পটাই বলতে। আর সেই গল্পের মধ্যে কিছু কিছু লেসন পাওয়া যাবে যে আসলে রিসার্চ, আমি তো শুধু রিসার্চের পরিপ্রেক্ষিতে একটা গবেষক হিসেবে কথা বলতে পারি, আমি নট পলিসি মেকার মাইসেলফ। এমন না, এটা এমন একটা ক্লাস না আমি একটা আমাদের সবাই বলতে পারবো ও পলিসি এইভাবে বানানো উচিত, সেই ব্যাপারে আমি কিছুই জানি না। পলিসি কিভাবে ঘটে, কেন পলিসি মেকার কোনো কোনো সময় আমাদের কথা শুনে, কোনো কোনো সময় শোনে না, সেটা বোঝা খুবই কঠিন। আমি শুধু আমার নিজের পরিবেশে বলতে পারি যে আমরা আমাদের কি ধরনের কাজ করা উচিত, যাদের অ্যানালিটিক্যাল স্কিল আছে, আমরা কিভাবে সেটা ব্যবহার করে we can be more helpful for policy makers in Bangladesh. এটাই আমার উদ্দেশ্য। আচ্ছা, তো সেটা সেই কথা মনে রেখে I'll just go through slides. So this is a slide that I actually prepared back in around April of 2020. So I'm presenting it, I'm telling the story chronologically. The pandemic প্রথমে আমাদের কি কাজ করবো, তারপরে as the virus evolved, how we had to respond to it. আচ্ছা, একটা কথা জিজ্ঞেস করে অর্গানাইজারদের, there's a big echo. আমি কি মাইক ছাড়া কথা বলতে পারি নাকি প্রবলেম হবে?
You can test 1 or 2 sentences if they can hear.
আমার কথা কি সবাই শুনতে পাচ্ছেন? পেছনে আমি আরো সামনে আসবো, পেছনে কি শোনা যাচ্ছে? না, প্রবলেম হলো ওই আচ্ছা, মাইকের ভলিউমটা কমাই দিলে হয়তো একোটা কম হবে। কোঅর্ডিনেটটা আচ্ছা, এটা এখানে থাকবে, ফাইন। আর দেখি, maybe it's a little better. Okay, so let's think back to March of 2020. That is better, thank you. So the pandemic had hit the rich countries first, right? US, UK, Italy. তখন আমাদের ধারণা হলো যে অবশ্যই এখন তো ছড়াই পড়ছে ভাইরাস সব দেশে, তো অবশ্যই সুনার লেটা আমাদের দেশেও আসবে। হ্যাঁ, আমি যেগুলো দেশে ওই সময় কাজ করছিলাম, বাংলাদেশ, নেপাল, সিয়েরা, হ্যাঁ, আমার মনে খুব ভয় ঢুকে গেল যে এই ভাইরাসের কারণে ইউকে, ইউএস, the US that is really the world scientific leader in global public health, right? তারাই হিমশিম খেয়ে যাচ্ছে, তো এই ভাইরাসটা আমাদের দেশে ঢুকলে আমাদের কী হবে, সেটা আর সেই ব্যাপারে কেউ চিন্তা করছিল না, কারণ সবাই ইউএসের কথাই চিন্তা হচ্ছিল। কারণ হলো আমি এই ভাইরাসের ব্যাপারে আমি একটা নতুন জিনিস শিখতে পারলাম, যেটা হলো যে unlike Ebola, unlike Zika, it hit the rich countries first, and then whenever something hits the US or UK, it sucks up all of the oxygen in the international media, right? That's all we hear about, right? And that's actually dangerous for the rest of the world. It's dangerous for one important reason, is that, so think about, if you were a policymaker in Bangladesh or Pakistan or Nigeria or Ghana, okay?
Now, no matter what happens, we're going to have a global recession, right? And as a leader, you're going to look bad. Okay? Now, either the virus numbers will escalate every day, we'll get fatality counts, death counts. It will make you look bad because the newspapers are reporting how many people are dying. Or you could shut down, right? And if you shut down, there's going to be a massive economic crisis, right? That's going to make you look bad, right? So now put yourself in the position of a leader, right? You're going to look back regardless, right? And of course, your challengers, the political challengers, are going to try to take this opportunity, right? They're going to try and highlight the fact that under your leadership, the country is failing, okay? So at that point, what is the strategy that you should pursue? One thing you could do is say, look, in BBC, CNN, etc., all day and night, we're hearing what the US is doing, flatten the curve, lockdown, etc., right? And so one strategy is, let's just follow whatever they're doing, right? We just blindly follow whatever policy action they're taking. So if they're locking down, maybe we should lock down as well, right? Now, another strategy is that, maybe that's not the right fit policy response for my country because I'm not the US, I'm not UK. My realities are different, right? And then I need to do something, that's the best strategy for my country, right? I really hope and wish that policymakers would take the latter strategy, but it's very, very dangerous for them to do it. They have to be incredibly brave to do it because they're going to look bad regardless. Now, if they just follow the strategies that the world leaders are following, the advice they get, at least they have some cover. অন্যরা যা করছে, যা আমাদের করতে বলেছে আমি সেটাই করেছি, তবুও আমাদের এত অসুবিধা হচ্ছে। কিন্তু আমি যদি নিজের মতো একটা অন্য কোনো ধরনের স্ট্র্যাটেজি নেই, তাতে যে হয় মানুষ মারা যাবে, না হলে বড় একটা রিসেশন হবে, right? Then you open up the possibility of being attacked. And so what happened after that? Why is it dangerous that it hit the US and UK first? Because all countries, regardless of their economic standing, they were pursuing the same strategy, and it's only the single strategy that we were hearing about, which is flatten the curve, lockdown, right? But there's a key difference in developed economies that have strong social safety net, right? Social benefit transfer systems, where you both have the money and the possibility of effectively and quickly sending money to people. You could try and provide insurance as you're locking down, right? But in a country like Bangladesh, where অনেকে দিনমজুরি, where or Pakistan or Nigeria, where people are day wage laborers and their families are dependent on whatever the person is earning that week to eat something, right? Locking down is much more dangerous, right? Economically, it's much more dangerous. It's going to be a much bigger economic crisis. And second, even if you lock down, people are not going to be able to abide by those guidelines because if they're hungry, they're going to go to markets, they're going to try and feed their families. Yeah? So it was important for us to get in the game at that point and think about what is the right strategy for developing countries. Right? That was one important goal I had in late March 2020. How actually I was actually thinking like everybody else, office bondo, lockdown হচ্ছে, আমরা এখন বাসায় বসে থাকবো আর নতুন কিছু হয়তো শিখবো, আমি রান্না করতে শিখবো, নাহলে রুটি বানাবো, whatever, right? আমি কয়েকদিন এরকম মনে ছিল, ছেলের সাথে আমরা পিং পং খেলতেছি, মানে টেবিল টেনিস খেলতেছি অনেক, তখনই আমার ছেলে আর মেয়ে দুজনেই বললো যে না এটা তো actually they were the ones who pushed me. They were saying that বাংলাদেশে আসলে খুবই অসুবিধা হতে পারে, you need to do something about this, you need to figure out what we should be doing. So that's how I got started thinking about it. So one important thought initially was we need to be thinking about policy responses in developing countries that's different, okay? And how it should be different compared to what we're hearing on the newspapers, right? So I'll tell you a little bit about that. Second, the other thing that was very, very clear is that we were in a very data poor environment, right? Even at Yale in New Haven, right, early in mid-March to late March 2020, we didn't have good testing set up, okay? So I knew that there's no way that testing infrastructure is going to be set up in rural Bangladesh within the next few months, and it never was, right? We're not South Korea, right? The US was not the beacon there. We didn't want to emulate the US. South Korea was setting the standard, but that's not where we're going to go, right? তো আমরা যদি টেস্টিং ইনফ্রাস্ট্রাকচার না থাকে তাহলে আমরা বুঝবো কেমনে কোথায় ভাইরাসটা ছড়াচ্ছে, যেখানে আমাদের মানে আরও বেশি টার্গেটিং করা দরকার, পলিসি টার্গেটিং দরকার। তো সেই ডেটার দরকার প্রয়োজন ছিল। সো দ্যাট ওয়াজ দ্য সেকেন্ড বিগ গোল। ওকে, আর তাছাড়া the other thing that was important for an economist to think about is that at this point the conversation was being led completely by epidemiologists and public health professionals, okay? Which maybe it should have been. However, when you move to a low-income or middle-income country, and this was as much or more of an economic crisis than it was a public health crisis, right? So this epidemiological model, so you might remember the Imperial College model that was being discussed on CNN, BBC, etc. all the time, right? That was decidedly and narrowly an epidemiological model which was about the behavior of the virus, right? But if you really want to do smart evidence-based policymaking, you can't just think about how the virus behaves, you also need to model how humans behave in reaction to the virus, right? You need to have an economic component that's merged with the epidemiological component, and you have to have a richer description of the world. That was also very important. Okay? Tachada, the other things that we started thinking about, which led to a lot of work in the subsequent few months, is on like specific sectors and specific actions. So for example, in Bangladesh, is it the case that we should worry more about migrant families, right? So we should be thinking of, maybe they will be experiencing the crisis differently, because even before the virus set foot in this country, right? Bangladesh was already affected because countries like Malaysia, Singapore, Italy were already affected, where we have lots of migrant workers, right? So that was going to lead to a lot of repatriation of the workers, and we need to think about how to handle that big inflow, right? And that's how the virus would also travel into the country, right? And second, it might have caused a big shock to remittances, right? Which accounts for, depending on the year, it accounts for maybe 6 to 10% of our GDP, right? And then other specific sectors, so that's one example, migration, right, or migrants. We should have been thinking about what's happening to our ready-made garment sector, right? Because initially there was a lot of cancellations of orders, right? And a lot of advocacy was needed to make sure that the people who had placed those orders at least pay for the orders that they had already placed, right? That kind of stuff. And then there are other countries in which there are specific things that we need to track, which may also be relevant for Bangladesh, but let me give you a different example. In Sierra Leone, it was important for us to think about whether men versus women, or male-headed versus female-headed households, were experiencing this crisis any differently, and do we need a different policy solution for women, right? Turns out it's true. They did have very different experiences of this crisis. And then what about specific action? Masks, right? So early on, we looked at the existing data. Of course, we didn't have fantastic data on the effectiveness of masks. We could only look at things like, okay, there are some countries that have pre-existing mask-wearing norms, like countries in East Asia, right? South Korea, Japan, just because of the history of SARS, etc. So they already were used to wearing masks. Many other countries did not. Okay? So we could just make some indirect statistical inferences on how the virus was moving in countries where people wear masks versus not. And it suggested that mask wearing was a promising strategy to limit the spread, to limit the transmission. But the WHO would not want to hear any of it. Okay? So in my early conversations with the WHO, right, we were like, okay, look, so this is a conversation with the chief scientist, Dr. Swaminathan, right? So the reaction was, look, no, we're not going to, they were being very wishy-washy with mask guidance around the world. And why is that? They're like, okay, look, we don't have any strong evidence on mask work. That's true. We didn't have a randomized controlled trial in the field to identify whether masks work or not. Sort of the gold standard that people set for evidence before they enact policies on the basis of it. Okay? And what if their concern was, okay, we don't have any strong evidence if it works, and what if we promote it aggressively and people get a false sense of security that masks are helping them, and then they stop doing the other things that we know work, such as social distancing, right? So we might inadvertently make the situation worse by promoting something that we are not completely sure that works, right? So that's led to us tracking what was happening with mask wearing in Bangladesh, in Nepal, etc., and then conducting a trial on masks in conjunction, like talking to the people who needed that evidence, like CDC and WHO. Okay? So essentially, I'm just giving you an overview now of what all the open questions were in March 2020. There was a lot to do, right? We were in uncharted territory. There was just so much that could go wrong, right? And it was our responsibility to do something to figure out what needed to be done in Bangladesh, because we could not just rely on whatever we are hearing from the global leaders, because they were themselves struggling with their own problems, right? They weren't thinking about us. So we ended up doing the following. So first of all, we don't have data, okay? At Yale, we didn't have data. So what we were doing is, I talked to the director of the Yale Institute of Global Health. They had come up with a algorithm, like on the basis of a few symptoms. Some were positive symptoms, like loss of taste, loss of smell. But then others, like congestion, was actually a negative symptom, like indicative of other respiratory infections, not COVID. So they were taking these symptoms and then making an indirect inference on whether COVID was likely present in this particular patient, right? So we just said, okay, let's just adopt that, right? And because we're not going to have testing data, let's try and collect that information for the whole country, right? So that's what we set about doing. So why were we collecting data? Well, first of all, we're researchers, but most importantly, for the previous few years, I had several samples of people, just for other projects, had nothing to do with public health. So samples of people around the country that we were tracking, okay? And so I had access to people and their phone numbers, and I knew the phone numbers were working because in mid-2019 I had called them and collected data from them. So we have a big office in Dhaka where we had been collecting data for the last 10, 12 years with enumerators. So we just redirected all those resources to do phone-based data collection instead of in person. Right? So this is not necessarily any clever research. It's just the simple act of collecting data. Okay? I felt like that was necessary just to get a sense of, around the country, what the prevalence of symptoms were. What about public health behaviors? Are people wearing masks? Are they social distancing? Do they know what COVID is? Do they know what the symptoms are? Right? And importantly, the economic dimensions as well. What's happening to food insecurity? Right? Is there losses of income, employment, etc.? Okay? So that's one of the things we did. So we basically started making thousands of phone calls every day. So that's what's on the top left, okay? Around the country. And the two things that are useful there, now I'm giving you a little bit of research insight. The two things that are useful there is, one, I had access to these statistically representative samples, which is much better than just like making some phone calls without knowing who I'm calling, or whether that whoever picks up, does that represent the country's situation, because you don't want to collect non-representative data and make the wrong types of inferences. Okay? And the second thing is that it's really useful to have baseline information, pre-COVID information, which is what we had for that sample. That's why it was useful. And a point here is that, look, if you want to help policymakers, right, with evidence, you should try to get high quality evidence. Okay? And there are small things that it's important to pay attention to, just so you don't actually mislead people. Okay? All right, so now that we're making lots and lots of these phone calls, right, we're like, okay, so that's a good opportunity for us to also use some of these phone calls to pass on information to people. Okay? And actually, early on, with YPF, we organized a meeting to figure out, who would want to volunteer to take on this task. And so we came up with a script with some that YPF members contributed to, like how you would talk to, say, a village imam, right, to tell them about COVID, how to take it seriously, and maybe discourage people from coming into the mosque. Okay? And then we went to A2I, the government's access to information, no, Aspire to Innovate. They changed their name. So they had databases of village imams. They had databases of school teachers, school headmasters, right? So we were trying to get those phone numbers to call and tell people about COVID, what we know, and ask them to pass on the message, right? So since you're making lots of phone calls to collect data, it made sense to just like take advantage of the fact that you were calling so many people. Okay? And then next I'll talk, we've already talked through the specific sectors. I'll give you some examples. I'll tell you about what we learned when we start taking the standard model, at that time the epidemiological model, and if you start adding economics to it, as well as if you start calibrating those models to developing country data. Right? That's the other task that we did. Okay? And finally, here's a really interesting piece of work that I've been struggling with for the last 2 years, and I'll tell you why we're struggling. So the idea is, so regardless of our position on whether we should lock down or not, one thing that everybody was in agreement about is that we need to get money in the hands of poor people quickly. Okay? But that's the challenge, and the challenge is that, say, in the US, how do they do it? Everybody submitted tax returns the previous year. So from those tax returns, you can tell who earns less than $75,000 or $50,000 a year. And on that basis, a check was sent, right? Or even like a online transfer. Okay? Now, in a country where only 2% or 4% of people are submitting taxes, like how do you even identify the poor? Like who should I send the money to? That's not an easy problem to solve quickly, right? And there's another dimension of the problem is that there's this category of new poor. So people who maybe generally were not hurting and would not be most deserving of benefit transfers, but now they are, because during COVID, they've lost their livelihood opportunities, right? We need to identify them. Now, there's no easy way for us to identify people quickly like that in a country of 160 million. So here's a trick that we thought about using, and this is the idea that I was trying to sell to policymakers here, which is, look, based on my data here for about 40,000 people, right? I have very detailed information of who is deserving of transfers, right? Of the 40,000, there's going to be some people who are hurting more than others, right? So I have like the ground truth for who's hurting or not, but the problem is I only have it for 40,000 people, right? But how do you actually use that information to do something for 160 million? So what you can do is, so the problem is for 160 million, nobody has the data. The government doesn't have that information, I don't, nobody does. But one thing that everybody carries around, or 90% of people carry around, is a cell phone. Okay? And it won't surprise you to learn that rich people and poor people use their cell phones differently, right? In terms of, say, the extent of talking versus texting, right? You can imagine that's an obvious one. But there are lots and lots of clues that people leave in their patterns of cell phone usage that might allow you to make an inference on whether this person is rich or poor, right? So what you could do is take those 40,000 where we have detailed information and we have the ground truth, look at their cell phone usage patterns, and apply a machine learning model to create an algorithm where on the basis of cell phone usage patterns, let's predict who's rich or poor. Now, if you build a model, and you feel confident that it's doing a pretty good job of discerning rich versus poor, then what you could do is take that algorithm that you've developed on the basis of your testing here, right, and hand it over to the cell phone companies who have the 100 million subscriber base, and they can just run the algorithm on their entire subscriber base and tell us who's likely rich or poor. Okay? Now, of course, there's going to be errors there. The machine is not going to pick up everybody perfectly. There's going to be inclusion errors and exclusion errors. Right? People who deserve it who won't get it. So you can, of course, add, then we thought about, okay, you can add a human element to it. So let's say the machine tells you high probability poverty, then we send a text message, get people to self-select as well. Okay? Now, why is it that we've been struggling with this for 2 years? Because the idea I presented in April of 2020. Now, getting access to cell phone call detail records, right? It's legally a very challenging thing in Bangladesh. Right. We were able to get this done for the country of Togo, a small country in West Africa, right? And they were able to send transfers during the crisis this way. Bangladesh, there's, in terms of call detail records, it's linked to anti-terrorism law, like who gets access and for what purpose. So it's not so easy. Huh? So the good news is we just got access, but it's not going to be useful, obviously, for the COVID-19 pandemic, but hopefully it will be useful for the next one, if there is one. All right, so let me get into a little bit of detail on this. on what we learned from modeling, adding developing country data. Okay? So the question we're asking is, okay, let me take, I'm not going to change anything. I'm just going to take the standard model everybody's talking about, the Imperial College model. And if you try to remember 2 years ago, we were hearing the term flatten the curve, right? That was coming out of that model, okay? What was that model telling us? That there is maybe I can go here. Yeah, so there is some healthcare capacity line, right? And if the curve of infections, if all the infections happen all at once, then there's going to be a lot of excess unnecessary deaths where people are getting sick, and sometimes for non-COVID related reasons, right? But there are no hospital beds. So they just die without healthcare. The type of thing that happened in India in April 2021 where people were dying on the street. Okay? So this is the concern that you don't want this curve to go above the number of hospital beds, the number of respirators, etc. So what you should do is social distance. We don't have a cure, so virus is going to spread, but we should just keep it under and make it flat and prolonged. That way, not everybody's getting sick all at once. Okay, that's the idea. Okay, so that meant that, okay, we should be locking down, and of course, locking down has costs, right? It has economic costs. So then the question I asked is, okay, let's take this model, the same one, right? Let's ask, if I were to calibrate this model to Bangladesh, Pakistan, Nigeria, India, Ghana data, do I get a different answer or do I get the same answer that the UK gave us, right? So we did that, and you actually get a different answer, right? And I'll tell you just 2 reasons why you do. One is that the age structure of the population is very different. Okay? We already knew back then that COVID was much more dangerous for the elderly. Right? In low-income countries, 3% of the population is elderly. In high-income countries, 18% of the population is elderly. There's a 600% difference, a 6-fold difference between the two, and that makes a huge difference in the predictions of the model. Okay? COVID is not as dangerous in low-income countries as it is in high-income countries in terms of fatality risk or serious illness risk. Okay? And so that's one reason. And the second reason the model gives you a different answer is that, look, you're trying to flatten the curve and keep it under this capacity line, right? But imagine you're in rural Bangladesh and your capacity line is down here. If I flatten it, right, I'm still going to get a lot unnecessary deaths. If I just delay infections by 3 months, it's not like suddenly a whole bunch of new hospital beds, respirators will appear and save lives. So I'm going to, so the benefits of social distancing is also going to be smaller, right? So now that benefits are smaller according to the model, then the question is, what about the costs, right? That's where our data became helpful, and on purpose, I'm actually showing you data that was reported back in April of 2020, okay, because I'm trying to do this chronologically. And so this is data from Nepal. I'm showing you the Nepal data. And it shows you why this, I was earlier telling you that baseline data is important, why that is. So there's a group, so this is all 2019, okay, pre-COVID. There's a group of people, I was actually there until yesterday morning in rural Western Nepal in the Terai, that we have been tracking for the last few years. And this is the fluctuations in the number of hours of work they have, right? It fluctuates with the crop cycle. As soon as there was a lockdown, here's what happens to employment. There was a massive shock that it was unprecedented, right? That's on economic activity. This is on food insecurity, right? So food insecurity is very high during a pre-harvest lean season, right? And then what you see is, here, and then what happens is that even though COVID hit during the harvest, the reported amounts of food insecurity was as if you're in the equivalent of like a manga period, okay? So the benefits are smaller, the costs are a lot larger, right? That's what led me to write these articles on, so this was an academic paper, but then I wrote a summary for Foreign Policy magazine with the title, Poor Countries Need to Think Twice About Social Distancing. Okay? And the argument is that we have to think carefully about imposing lockdowns. Part of it was practical. Can people actually follow those rules? There's a question, but most importantly, the costs can be very, very high, right? When you're in a country without proper social safety net, right? If you try to impose lockdowns and people can't come out, right? They're going to be hurting economically, and that's what we see in Nepal. We actually see, when you ask people directly, what are you worried about? after COVID hit, during their lockdown, they weren't worried about health and safety. They were really worried about the income shock and the food insecurity. Right? People can die of other causes as well. Okay. All right, so now let me move to, so that's the research part. So let me move to policy. What was the reaction? So this, before I tell you the reaction, I should say that this was, when I say poor countries, I was making a point. The reason I wrote this, linking to my earlier comments, is that I just wanted to give policymakers in poor countries and low and middle income countries some cover so that they could think a little bit more flexibly and openly about what policy is sensible for them. I wasn't suggesting here strongly that nobody should lock down or that everybody should. More that every country has a different metric of costs and benefits. You need to think about that carefully and make those decisions. Right? And the reason that was important to do and write in Foreign Policy magazine, that's something that policymakers read as opposed to the general public, right? Is that, I was worried that policymakers, like in India, what happened was they just imposed a lockdown without thinking about the detailed, this is back in April of 2020, right? They imposed a lockdown and that caused massive amounts of pain especially for migrant workers, for informal sector workers living in cities, that all transport was shut down. There were people who had to walk for days to say return to Bihar or Odisha. And when the policymakers weren't thinking carefully about what's the reality in my country as opposed to let me just do whatever the US and UK are doing. Okay? Okay, so all right, so now what was the policy reaction? So I'm going to tell you both positive and negative reactions. This wasn't easy, right? It wasn't that everybody was happy with whatever I was doing. Okay? So here's a positive reaction first. Oh, before I do that, so that was for poor countries, and in the same magazine, in Foreign Policy, I also wrote one for rich countries, right? Where the argument was there's only one right answer. You have to impose strict early lockdowns to crush the virus, and then that'll enable a return to economic growth. Okay? For rich countries, there was no excuse to not lock down. If you have a social safety net, you need to get rid of the virus, right? That's not something that Nigeria or Bangladesh maybe can afford, but rich countries should, right? And here's the reason why. This is a graph from that article. So here I'm plotting what happened to mobility in, so this line here is New Zealand and the blue line is the United States. Okay? So this is, so we're setting the pre-COVID mobility to 0, normalizing that to 0, okay? And this is the drop in mobility as soon as COVID hit. So this is March of 2020. Okay? So lockdown hits. In New Zealand, the lockdown was complete. Their mobility goes down by 95%. So almost nobody's moving around. Okay? So this is based on Google tracking whether people's smartphones are moving around or not with location trackers. Right? So New Zealand had complete lockdown. In the US, we never got there. It was about a 45% reduction in mobility relative to the pre-pandemic normal. Okay? And what happens as a result is that New Zealand is able to completely crush the virus, and it enables a return to normalcy by July of 2020, within a couple of months. Okay? And then there was another scare, but this scare was 5 cases. Okay? And then they locked down again, and then throughout 2021, they were at normal. And here's what happened to the US. You never fully got rid of the virus, and as a result, the economy stayed depressed for a period of 18 months to 24 months. Okay, so why am I showing you this? Because the answer varies by local economic conditions. Okay? All right, so what was the reaction to all of this? So one reaction was actually positive. So in Africa, people were reacting well. So I did events with the president of Ghana, the vice president of Nigeria, and we were talking about and they were very sensible people. I was extremely impressed with the president of Ghana, especially relative to the president of the United States at the time, and what a joke that was. So that was positive. And then we also tried to, this is actually a picture that Abir took, because I was talking and he took a screenshot and I just found it on my WhatsApp. So we were also talking to sort of international leaders like Tim Geithner, and I did events with them so that we could get the word out, because these guys have important policy influence in large numbers of countries, right, that I couldn't reach. But here's the negative reaction. So there's Dawn, which is the main English language daily in Pakistan. By the way, I have no connection to Pakistan. I don't know anything about Pakistan politics. Okay? And the paper was not specific to Pakistan either. Okay? So what I understand, well, here's what happened. One night, my email, phone, WhatsApp, etc. starts lighting up, like dozens of messages. Oh, I'm so sorry. Did you see this? I hope you're okay. So I hadn't seen it, so I went and looked. So the main like economics, finance journalist for Dawn. So he wrote an article where I'm not sure why he needed to use this language, but his article was this economist of Bangladeshi extraction doesn't care about Pakistani lives, only cares about American lives, and is giving our government bad advice that's killing millions of Pakistanis. Okay? And economists need to stay in their lane and shut up. Okay, fine. I don't know why the fact that I'm of Bangladeshi extraction has anything to do with anything. So that was annoying. But the thing is that, you know, he was, and then I later figured out from my friends in Pakistan what happened was their planning minister Asad Omar went on TV and said, okay, we need to roll back our lockdown because this Yale study suggests there is large economic costs. And so that's when the journalist read the Yale study, and later on I figured out that this particular newspaper was really against the Imran Khan government, right? And that was what was going on, and I was just, I mean, it wasn't relevant to me, but I was in the middle of it. But, you know, it was important for us to set the record straight, right? And then, luckily for me, just 3 tweets was enough to do it because their argument was really stupid. And luckily for me, then Pakistanis took over. So I only have to write 3 tweets, and then they handle the rest. I now have lots of friends in Pakistan. Okay, so, all right, so that's kind of, okay, so why am I telling this story? It's that, you know, when you are trying to guide policy through evidence, right? Sometimes people will read and interpret things not talking to you. But nobody in Pakistan in government had talked to me about like what it is that we were trying to say, right? And sometimes it just goes out of your control. And it's important, like communication and the carefulness with which you need to write is actually very, very important. But it's also important to keep and stay engaged. So you also need to work to set the record straight when you need to. Huh? And not all policy interaction is positive. Okay, so now let me tell you about like very specific things where I was trying to figure out, okay, what is it that the Bangladesh government needs, other than the fact that we could create maps and say that, look, here are the various places where we're seeing more symptoms, where the food security was worse, etc. Okay. So one of the things is early on, so my main counterpart was Onir Chaudhary at A2I. And you know, he was very, very impressive in that, like I was talking to him on WhatsApp at 3 a.m. Dhaka time and again at 10 a.m. Dhaka time. He just wasn't getting any sleep during that time. And I was trying to figure out by talking to him and to his team and others, okay, what are the gaps that they perceive and how can we help, right? So here we connected with, and at that time, one of the, actually the most useful thing I can talk about is I tried to connect with Bangladeshi diaspora as well as people with a variety of skills, right? Different networks, and YPF was wonderful for that. I already told you that, you know, we had collaborated on those phone calls and the scripts for imams, etc., right? And then here I connected with economists. So both Bangladeshi economists based in Dhaka as well as Bangladeshi economists based in places like Australia, Canada, United States, etc., right? And we all had different types of data, and we sort of brainstormed about what type of data might be useful for our government for their current needs, okay? So let me give you just one example of this. So if you're trying to figure out where the virus is, right? Okay? We don't have any testing data because there was no testing in the country at the time, okay? How do you do it? Here was a trick. So the virus is coming into the country, we know, via migrants, right? People returning from Italy, people returning from Singapore, okay? Now, it turns out there's lots and lots of data sources. If you could mine it, you could get a sense of where the virus is spreading indirectly. So for example, you know, every time you come into the Dhaka airport, you have to fill out this embarkation card or disembarkation card, whatever it is, right? And there, for people leaving and coming in, they are writing down what their address is, তার ঠিকানা কোন জেলা, কোন উপজেলা, এগুলো সব লেখা থাকে। So then what you could do is take all these and figure out who was coming back from Italy and which districts are they going to, who was coming back from Singapore. So basically what you could do is take data on where the virus was in other parts of the world, Italy, Singapore versus US versus UK versus Japan, right? And then connect it to migrant returnees from each of those countries, and then connect it to the upojela, thana, jela that those migrants were returning to. Right? And that gives you a prediction of where the virus is likely to be. Okay? Is that prediction producing anything useful? So that's what this is. So on the x-axis, we have our prediction. Okay? This is my predicted number of cases. On the y-axis is the distress calls to the 333 number. You know, the 333 number was repurposed for people to make calls, right? Distress calls about COVID. And here's what the correlation was, right? So we were getting other signals that, you know, what we're picking up by indirectly inferring where the migrants were returning, right? We were getting other signals that, yeah, that's likely picking up something about where COVID is likely to be because people seem to be more symptomatic there. And also we had symptoms data too, right? So we could check it against that as well. Okay? And we saw, for example, in the symptoms data, we saw that if in a community people had a recent migrant returnee, they were 3 times as likely to report COVID-like symptoms. Right? So that was, you know, that's helpful. By the way, it's only helpful for a certain time period, right? It's only helpful until you have testing data. Once you have the proper testing data, you don't need this anymore. Right? All right, so then what we did for the government was create maps like this. You can't see the colors very well, but the idea is like, let's try and give people some signals as to where exactly COVID is likely to be. Right? Because it's helpful for us to know, you know, for us to redirect resources that way. Okay, here's another thing I was frustrated about. So we were in South Asia, in India, Pakistan, Bangladesh, we were hearing so much about what's happening in US and UK trying to emulate those strategies, right? The other country where I was working at the time is actually much poorer than Bangladesh, in Sierra Leone. Okay? And Sierra Leone was doing a fabulous job in responding to COVID, even relative to the US, I would say. Okay? Why is that? One reason was that they had experience. Right? They had recently had to deal with the Ebola pandemic, and they made a lot of mistakes during Ebola, which was very helpful during this period. Okay? So I wrote this op-ed in the New York Times where I was trying to make the point that, look, countries like Bangladesh, instead of wasting time thinking about what South Korea is doing, which we cannot replicate, right? We should be thinking about all the frugal innovations that Sierra Leone has been able to implement very successfully and cost effectively. Right? Okay, and this one, actually, I just wanted to show you something for fun, which is look at, so this is, do you guys remember at some point this ex-president who will not be named was talking about shithole countries, we're getting immigrants from shithole countries in Africa, right? And now, by November 2020, it became clear that the US's response to COVID was just a disaster, right? And many African countries did really well, including Sierra Leone, right? So CNN asked me to write something about this, which I did, on the condition that they would publish it on November 3rd of 2020. Do you know the significance of the date? No, that was the day of the election. Yeah. So morning of 2020, right? Talking about here's what shithole countries can teach you how to respond. Anyway, that's not relevant to Bangladesh policy. I was just proud of the fact that I got the date right. Okay, so now let me move back to data, right? So, and the importance of networking. Okay? So I already mentioned that I was collecting data in a few countries where I work, in Bangladesh, in Nepal, and Sierra Leone. Okay? But there were other researchers who could do the same, and then later on World Bank got into that. They could collect data in other places. Now, each of these data sets is imperfect, right? Because I have access to certain samples of convenience, right? But others have access to other samples of convenience. So we decided to put it all together across all these different countries, all the data, to try and give the world a sense of what was happening in low and middle income countries across the world, right? And the thing that we learned was that this was an unprecedented global crisis, right? This is global GDP growth. So this is its macro data, not our data, right? this is that Great Recession of 2008, right? That was the drop, right? And here's the COVID drop. This was massive, and so we looked at specific, at the micro level, like exactly what was the harm that was being caused around the world. And we, combined data from many different countries, and you learn that there were, a median across all these countries, like median 70% of people were reporting a drop in income, and 45% of people were reporting either missing meals or reducing portion sizes, etc. Right? So consumption smoothing wasn't happening. So what happens when there's a drop in income? People dip into their savings or they take loans or whatever, but it wasn't working. Right? People were actually seeing nutritional deficiencies. Right? This required a lot of attention. Let me skip over. So we also looked at data from specific sort of enterprises, both household and business enterprises, and then what was happening with prices, etc. All right. So here's one quick lesson on this is now I'm shifting over to a research lesson. Okay? So when we collect data, how do we make it useful, and how do we draw inferences that it's actually going to be policy relevant and useful? So the line here is tracking food insecurity across the year, right? But it's tracking food insecurity in a normal year, the black line. Like this is data from 2016, right? We could do this in Nepal, we could do this in Bangladesh, and you have the same type of pattern. There is seasonal variation in food insecurity because before the harvest, there's not much work, and that's when people suffer, right? And then now look at 2019, 2020, which is the blue dots, okay? So 2019, 2020, until the pandemic hits, until January, looks like a normal year. It sits right on top of the ordinary year black line. And here's what happens in post-pandemic. Okay? So why does inference have to be careful? So if I didn't have the baseline information, right? I just look at food insecurity here, it actually looks better than what it was 6 months prior. Right? And so if I just compared the blue dots, I would make the exact wrong inference. Right? That's why baseline is so important, and that's why careful data collection so that you don't mislead the government with, in this case, if I didn't have the baseline, I might have made the indirect inference that, look, incorrect inference that, oh, maybe COVID is not really bothering us that much. Right? But it was important to note that COVID, relative to what the situation is supposed to be, it was actually bad. So even though, luckily, COVID hit during the harvest, right? That was lucky for us, for Bangladesh, for Nepal, right? Because it could have caused much more economic harm and pain if it happened in this period, right? So now, so first of all, like noting that COVID hit during the harvest is useful because we had to also warn the governments that, look, even though people may not be complaining so much right now, if this is combined with this period, that could be really dangerous, right? And you have to pay attention to that, right? Just because your lockdown policy right now is working and people aren't complaining of hunger doesn't mean that this is going to stay the same. No? Oh, and then Sierra Leone, like that's where we looked at gender differences in responses, and the reason is a third of households are female-headed. And what you find is, I'll just skip over it and tell you the story. What you find is that households that are female-headed, they were less likely to actually know about COVID, identify symptoms correctly, right? They were just less connected to mainstream information sources, okay? As a result, they were also less able to react to it. So they weren't engaging in the public health protective behavior, they weren't distancing, they were less likely to wear masks, etc., right? And food insecurity was actually worse in those households. And even though those female-headed households were doing much worse, they weren't any more likely to receive government support than male-headed, right? So it's important for us to also, on evidence, we need to think about specific sectors, groups, subgroups that the government should pay attention to and provide that information. All right, so now, so moving forward chronologically, so that was happening for the first year of COVID, essentially. I just went through what we were doing for the first year, right? And then the second year, now we have results because, remember earlier I told the story, we were talking to the WHO, was claiming there's no evidence. So we're like, okay, we need to provide that evidence. Okay? So we did that in Bangladesh, and I'm happy to report Bangladesh provided the largest, actually the only large-scale randomized controlled trial in the field on the effectiveness of masks, and it still remains the last word on what masks do. Okay? And so this was in collaboration with, there was a lot of social science here, but also a lot of medicine and epidemiology, right? And the reason is we were trying to answer two questions. Question number one is, how do we get people to wear masks, right? As we know, it's not easy. Behavior change isn't easy, right? That's true for the sanitation sector. That's true for water purification. Yeah? It's not easy for us to get people to invest in toilets. So similarly, it's not easy to get people to get vaccines or wear masks. And we need to think about how do we change behavior. That's number one. And number two is, if you can change behavior, we need to check whether that actually leads to healthier outcomes. Does it lead to a reduction in COVID transmission? Okay? So that first question, how do you change behavior? That's a social science question. That's where economists, psychologists, sociologists should play a role. The second question is a medicine public health question. That's where we collaborated with Stanford Medical School and had them lead that work. Yeah? So we set out to answer these questions, and then beyond these questions also, it became important to think about, okay, look, if we find a strategy that works, how do you quickly scale that up to reach millions of people? Because masks are going to be effective only if people wear them. So we did a cluster randomized control trial, which cluster randomized control trial means that an entire cluster, like an entire village, an entire community, plus the mosque that serves that village, the market that serves that village, anybody coming into the mosque or market, they were the subject of a treatment, right? So that's, everybody gets treated, every single household in that cluster. And then there's a separate community that's physically distant from these ones that remain untreated. And we worked in a total of 600 different communities. Okay? 300 got treated and 300 did not. And we collected data from about 340,000 adults. Right? So it was an unusually large trial in that, say, by comparison, say Pfizer's vaccine trial involved like 40,000 people. Right? We needed to be larger because if you want to detect the effect of mask wearing, which is of course a lot milder than actually putting an injection in somebody, right? You need much larger samples to make statistically precise determinations on whether it's working or not. So now, since you have such a large sample that you need for this impact of COVID, right? You could take advantage of that extra large sample and say, look, instead of running a 2-arm trial, I can run a 20-arm trial. Let me throw 20 different things at it and see if I can get people to wear masks. Okay? And then I'll tell you what works. Right. So I'll just jump to, out of those 20 things, what works. And there were 4 things that if you do them in conjunction, that led to persistent increases in mask wearing, and that's free door-to-door distribution of masks. Okay? We went to every household in the community, distributed masks, and as we did, we also provided information. So we made a little, stitched together a little video where the Prime Minister, Sheikh Hasina, recorded a little clip. The director of the Imam Training Academy in Dhaka, a religious leader, recorded a little clip. And perhaps most importantly, Shakib Al-Hassan recorded a little clip for us. And we showed people their endorsement and why mask wearing is important. Okay? And then we also went to mosques to do a secondary mask distribution because it's important to that's an epidemiologically risky place where, especially during Jummah prayers, people are standing shoulder to shoulder in close proximity, right? And there could be a lot of transmission. So we made sure that as people were coming into the mosque that they had masks, and that also gave us an opportunity to work with the imam, explain to him and his team why this was important, got him to endorse the concept, and during the khutbah he also said something about the importance of this. And it was also important not only the imam but all other community leaders, right? Could be the union Porishad chairman or members if they lived in the village, or the school headmaster, right? Got them to endorse it. And the reason that was important is that we learned that even after doing all these 3 things, because we had this large sample, we did iterative experimentation, right? So we did these 3 things, mask wearing went up, but not so much that made me feel comfortable that, that's sufficient change in behavior that I can track COVID infection rates. So then we started tying additional things. And what we learned was this reinforcement was entirely necessary. Okay? So the idea is that you can't just like distribute masks on one day and leave. So you got to go back to the village, right? And we hire what we call mass promoters. We try to hire them locally, and their job was like walking around in the village, like let's say in the streets or sitting at the tea stalls, etc. And if somebody is not wearing a mask, they could go up and say, "Tamra to prottekta barite ekhane mask দেওয়া হয়েছে, আপনি পড়েন না কেন, প্লিজ পড়ে ফেলেন, আর যদি ভুলে যে থাকেন বাসায় গিয়ে নিয়ে আসেন, আর সেটা যদি ইনকনভিনিয়েন্ট হয় তাহলে এই যে আমার হাতে আর একটা এক্সট্রা মাস্ক আছে, এটা পরে নেন, কিন্তু পরের বার ভুলেন না কারণ আমাদের হাতে এগুলো এত বেশি নাই." So it turns out people really disliked being intercepted, right? And that's why it was also important to get this, because sometimes the reaction would be, আপনি কে আমাকে এগুলো বলার জন্য? So then we had to say, না আমরা তো বলছি না, চেয়ারম্যান সাহেব আমাকে পাঠাইছে, বা ইমাম, চেয়ারম্যান সাহেব, স্কুলের হেডমাস্টার, ওনারা সবাই জানে, ওনার এডুকেশন। So once we did this, once we added this, like the first week we did 3 times a week, then 2, then 1, we slowly like reduced the frequency. So our effect sizes tripled once we add this. This was really important. People really felt like they needed to avoid this awkward conversation. Like that really worked. And so we see that in the control villages, proper mask wearing covering nose and mouth was 13% and went up to 42%. And it was sustained for 10 weeks, right? So this is the data across those 10 weeks. In the control villages, mask wearing was always around 12%. In the treatment villages, it was at like 45, right? And this is when the masks were distributed. And importantly, these 2 data points are after we ended all intervention activities. So what was exciting about this is that even after you leave the village, people seem to continue wearing masks because we had a separate team sort of passively monitoring, like people sitting with their smartphones, and we had an app where they could just, as people walk by, they could just record who's wearing or who's not, right? So that's what this data is from. And then remember the WHO concern that if you get people to wear masks, they might stop doing sensible things like social distancing. So that's the idea of a moral hazard. Okay? We tracked that because they were concerned about it. And in fact, we found the opposite, that when you do mass promotion, that leads to more physical social distancing, not less. So in markets, we were more likely to observe people staying away from each other. Why would that be? Like when you start doing this intensive promotion, people seem to take everything more seriously. Right? So that was important just to get the WHO and CDC to pay attention to this as well. Okay. And there was a whole bunch of things, by the way, that, okay, this is why you do research. Research isn't just to, confirm some suspicion you already have. So we tried 20 things, 15 of them was not necessary or did not really work well. For example, text message reminders. There's a lot of data that suggests that, if you remind people, they're more likely to follow through. Turns out in Bangladesh, that's not true. People get too many text messages, right? We don't pay attention to text messages, okay? Then, psychologists tell us that if you get people to make a verbal commitment, then they're more likely to follow through. We tried that, nothing. Okay? We even tried, economists tell us incentives matter, right? There are monetary incentives that we sometimes give for investments. But also, like in India, in sanitation program, they give prizes like open defecation free ODF villages, right? So we borrowed those ideas and tried it, okay? We didn't get anything. That's not to say it will not work somewhere else or in some other sector. It's just that's why research is important. You try things, right? Some things don't work, other things work, right? And you want to scale up only the subset of things that work because that's going to be cost effective, right? If I want to reach 160 million people, I can't afford to waste money on all these things that are not producing much for me. Okay? All right, so here's the summary of results. So now I'm showing the second stage. We see this 29 percentage point increase in mask wearing. That led to an 11% reduction in COVID symptoms. And then we collected blood samples from the people who reported COVID symptoms. So this is so we're doing something called seroprevalence surveys. So you take the blood sample and you look for COVID antibodies, whether this person's system has seen COVID or not. And you see a 9.5% reduction in symptomatic seropositivity. Okay? So that's what kind of nails it, that masks actually reduce COVID. And this 9.5% reduction is coming off of a 29 percentage point increase in mask wearing. Okay? So this is not a move from 0 to 100. Right? And the reason I'm pointing it out, and again, this is about policy impact. So it turns out, I got in a lot of trouble for no good reason, like during this freaking pandemic. So mask wearing is a totally political thing in the US, right? So for this result that I'm showing you, we got attacked from both the right and the left. Okay? The right was understandable. They had a strong identity that masks are being forced on us, they don't work, right? And they were, like this guy, Ben Shapiro, who's a right-wing, I don't know what he is. He's not a thinker, like a right-wing non-thinker. So he takes this, and his reaction to this, this study shows that mask wearing doesn't work. Right? That was just like an insane interpretation of the data, but whatever. And he seemed like I had to engage with him, but he seemed just like a fundamentally dishonest person. Okay? So that's a right wing. I expected that. Right? Here's what happened from the left wing. Okay? They're like, we already knew mask wearing worked, right? So why are Americans going and torturing poor Bangladeshis to learn about something we already know? Okay? So my first reaction was, look, I'm not an American. I'm doing this because I'm a Bangladeshi, and this is important for our policy. Like, we need to avoid the type of crisis that's happening in India right now. Right? And mask wearing might have a lot to do with that. Okay? And second, like, not everything is about America. Right? When we have evidence, it's not that I'm doing it in service of America. If you want to interpret the data, fine, but this is not done for you. Right? It's just like people on the left, I think they weren't thinking about what was coming out of their mouth and what it implies about what they think the world, that the world revolves around them. And then the other reaction that was really strange was, look, the effect size, this effect size, there is an effect, but it's small compared to a vaccine. We should just be talking about vaccines, right? This is a distraction. Okay? But at that time, in April 2021, you have a vaccine, my people don't, right? So, just assuming that this is irrelevant because everybody in the US has access to vaccine, that's also just really selfish and like US-centric in a very strange way. And then one of the nice things about these results, like we had said that we would look at age, like effects for different age groups, and what you find is the largest reduction among the elderly. Like the mask wearing had the largest reduction. We were able to eliminate about a third of all infections among the elderly, so that was important just because it's most risky for them. Okay, one of the things, the other things we learned, we also had an engineering component of the team, so we designed masks carefully. So, something that early on we were unsure about whether we should be promoting surgical masks or cloth masks. Right? I'm happy to see most people here are wearing surgical masks instead of cloth, because we learned from the engineering data that the filtration efficiency is a lot higher, and even in the field, this is what led to much more precise reduction than COVID. So why did we try both? So initially, before launching the trial, I had lots of meetings with ICDDRB folks, then DGHS, and there was a strong feeling among the experts in Dhaka that this is not going to work because people perceive this to be a low quality, one-time use product, right? Although our data suggested, like the way we did it before launching the trial, we actually ran lab tests. We tested filtration efficiency. Starts out at 97%. You wash it with like wheel soap, the type of soap that rural people would use. You test it again, you wash it up to 20 times, and the filtration efficiency was still at 70% or 75%. And cloth masks, it starts at about 40%. Even a new, well-designed cloth mask, we did a triple layer cloth mask, right? So sorry to say some of the cloth masks you're wearing back there, it's not doing much. No, actually it's better than nothing, for sure. Okay. And then to deal with the fact that it was one-time use, so we put this little sticker, and লেখা এই mask ধুতে পারেন আবার পরতে পারেন. So just to tell people that they don't have to throw this away, they can keep doing it. This actually doubled the cost of the mask, right? This putting the sticker on. Sticker chhara, we ended up ordering millions of masks because we distributed all over the country. স্টিকার ছাড়া 5 টাকা 5.5 টাকায় মাস্ক পাওয়া যায়, এই স্টিকার সহ মাস্কটা 11 টাকা লাগছে। All right, and then, so now it's April 2021, we have these results. We don't have the full set of results, but the crisis is India, right? And I had taken, actually, I had spent a little bit of time, like taking some time off, and then suddenly this crisis hits, and then we had to redefine ourselves, right? That we are now the mass people, and we went out distributing mass everywhere. Okay? So the way to like get the word out. So one is, you know, you have to publish the trial, get it peer reviewed, etc. So we published in Science, and you know, there's been a lot of just because of the politicization of mass, there's been a lot of really careful nitpicking of our data, but it's held up so far. And we also started writing, or it got covered by the international media. Like initially, the Washington Post broke the story, but then later on, everybody, Economist, The Guardian, Daily Mail, and New York Times, etc., picked it up, right? And I was very happy to see everybody just like the Bangladesh study became part of the lexicon. So people just talked about the Bangladesh study. Right? Yeah, and then this particular quote was really nice. The Bangladesh study, that's how people are referring. It was still perhaps the most important research done during the pandemic outside of vaccine trials. And then I made presentations to the WHO, CDC, etc., and then their guidance did get updated, citing our study. Okay? So they came around. Okay, so now let's do a little bit of a storytelling about policy change, right? So the next thing I did was we had these results, so we needed to figure out how do we get millions of masks out to people, right? We're researchers, I'm not capable of doing that, right? We need governments or large non-government organizations to take that role, right? So we ended up you know, working intensively in 4 countries in South Asia, so Pakistan, Nepal, Bangladesh, and India. And you know, I like was having conversations day and night with different governments, so mostly state governments in India, because in India, if you want to reach millions of people, you really need to go through state governments. Okay? So it was really difficult to get ultimately governments to act everywhere, and except Pakistan, the Lahore city government and the Punjab government, they did really well, right, in distributing mass all throughout the city, and I'll show you some pictures soon and what we learned from that. Nepal was also, the government was involved, but they were funded outside. And in India, we ended up only having success through non-government organizations. I shouldn't say that. Like Bihar, we were successful through government, but in other states where we spent a lot of time, in Gujarat and Telangana, ultimately the government said, okay, look, we will pass on your information, but we don't have the budget to buy all these masks, right? Or, you know, there wasn't a high enough priority for them. Okay? So let me talk to you a little bit about what happens in Bangladesh. Okay, so here's a policy lesson. Okay? So one thing we learned was researchers are not particularly good at translating research into actionable policy. Okay? So if I just write up a paper, publish a paper, and show statistical results, that's necessary, but that's far from sufficient. Okay? So I ended up hiring people. So this particular approach to like reporting our results. So it was somebody who worked with the Gujarat state government for many years and had great experience, but also had one foot in the research world, right? Like was very good at just putting himself in the shoes of a government officer and thinking about, okay, what action and what specific information does a particular bureaucrat need so that he could turn it into a specific action that he or she could take. Okay? So that's why we ended up like taking all of our information. A lot of it wasn't the research results. A lot of it was the exactly the process of conducting the work, right? So then all of this was sort of clickable for any government. You know, we put this like something like a toolkit up online. Everything was clickable. And so let's say there was a government officer the staff member who could procure masks, right? They could click on this, figure out how many masks they would need, right? Think about, okay, like if I have to do a procurement contract with the mask manufacturer, what are the materials I need to insist on, right? Et cetera. And also we put in our contracts, right? That they could just edit and things like that. So the idea is that, like, if you really want policy change quickly, and in this case, we were running against time, right? We really needed to make this work quickly. If you needed to make it work quickly, then you need to make it simple, such that a bureaucrat could just do it in his day-to-day job or in her day-to-day job, right, without having to think about how to translate research into whatever action they need to take. Okay? So this is the type of thing, I'm pausing here because this is the type of thing that already I feel like the YPF network could contribute to, in the sense of if you really want to promote evidence-based policymaking, okay, there are people supplying evidence, right, and you could, engage with them, learn, right, and hopefully put yourself in a position to produce evidence in the future, right? And then there are other people who are using evidence, like policymakers, or should be using evidence, right? And we need to understand what their constraints are, right? So it's not enough for us to just like sit back and complain, look, we have all these research results and the government isn't using it, right? They're not using it because they're busy, not necessarily because they don't want to, right? Or this is not their first priority, okay? So we need to really think about what their constraints are. Like that could be a budgeting constraint, it could be an administrative constraint, but sometimes it could be a political constraint as well, right? Their objective function is, I need to get reelected, not I need to use evidence, right? It's not like my voters are gonna ask me, did you use evidence, right? So we actually, there is, I've noticed through this work that there is a gap, which is people who can act as interlocutors between the evidence generators and the evidence users, right? So that requires you to be smart enough to understand and discern good from bad evidence, right? But also have the experience where you understand how, under what constraints do the evidence users work, right? And if you have these translators, I think that could really be good for the country, right? And I imagine like just engaging with the YPF network, that there are many people who would be able to play that role well. All right, so ultimately what we did take the norm model that I described from the research, and we implemented it in about half the country. So with BRAC, so BRAC had an existing network of Shasta Kurmis, Shasta Shibikas, and they were in good position to do all the tasks, the mass norm tasks that I talked about, door-to-door distribution plus plus the reinforcement, etc. Okay. All right, and now to get this done, we needed millions of masks. Right? The government, the DGH, Asif Saleh and I met with DGHS, and they gave us the responsibility. Okay, you can do all these districts that have higher positivity rates at the time. Right? Now, the second sentence that I was hoping for is, yes, you guys should take the responsibility to do it. That model works. And here's money for you to procure the 80 million masks. Somehow that second sentence never came. Okay? That was a little frustrating. So then we had to continue going around and begging. And I wanted to show you a little video of where exactly this worked out well. But I don't think the video will work here. So there was an event that BIDS, Binoy Chen, who's the Director General of BIDS, so he hosted. And so he had both me and Asif present. And we had discussants both from government as well as from the civil society intelligentsia of the country, like Dr. Firdausi Qadri from ICDDRB, who's a public health specialist, then somebody from the finance ministry, Dr. Moshir Rahman, who's the economic advisor to the Prime Minister, Dr. Atir Rahman, the former governor of Central Bank, Bangladesh Bank, right? So they all discussed. And it ended up being, I still remember because it was late at night in the US, supposed to be a 1.5-hour event, and it turned out to be a 3.5-hour event, but everybody stayed, right? I was up till like 2:30 in the morning talking. And then here's what happened. So around this time, Asif and I were really heavily trying to promote this idea and trying to generate some interest in this, right? So, and we went to various media. So we wrote an op-ed in the Daily Star. We wrote a Bangla op-ed in Prothom Alo, right? We did a program in Channel 24, talking about why it's important to do, right? And then this BIDS event actually, like after all that effort, the BIDS event was like really allowed us to turn the corner, right? So what happened at the event was the finance secretary says, oh, এখানে টাকার কোনো প্রবলেম নাই, আমাদের অনেক টাকা আছে, এটা আমরা টাকা খরচই করতে পারছি না, মানে ভ্যাকসিনের প্রয়োজন কিন্তু ভ্যাকসিন দেওয়া যাচ্ছে না, টাকা খরচ হচ্ছে না. That was nice, except that wasn't very useful, right? But then Dr. Atir Rahman came on, and prior to that, I remember seeing him, he was on the phone, right? And I was like, oh no, he's not paying attention, right? You know what happens here in seminars, everybody's on the phone, etc., right? So I was disappointed, except he comes on and says, oh, I was on the phone with CEOs of various commercial banks, the private banks, right? And we need to do it. It's great that the finance secretary said, I just watched the video this morning, that's why I remember the words very clearly. So he says, yeah, it's great that the finance secretary says that, there's money, but I understand those government processes, and by the time that money gets released, right, it's going to be too late, right? Because at this time, when was this happening? When India, we were hearing news every day that people are dying on the streets, right? And we were seeing higher positivity rates in our border districts. Nepal got it badly as well, right? And we were worried about what's happening in Bangladesh. So he said, if you wait for that, it's not going to happen. Instead, I was just on the phone with them. Tomorrow you guys should present to the CEOs of all the commercial banks, right? And we did. And I didn't know exactly what happened because the money went to BRAC. So Asif Bhai told me yesterday. So they came up with, within 4 weeks, they gave BRAC 15 crore taka, right? We needed 25, and they covered most of it, and the Swiss government gave us the rest, right? And here's the other thing that happened. So I went around begging people for masks, and I learned from like a Gates Foundation contact that there was some American company that had a lot of masks. Yeah? So it turned out to be, and I couldn't figure out who until like I did, and then I just cold called them, right? I got to tell you a funny story about that. So it was Hanes Brands, the t-shirt company. So they had made a lot of masks for the US market, and but people weren't wearing masks, so they had an excess. And so they were looking for some donations so they could get a tax write-off, right? So I talked to them and I said, okay, we're happy to take the mask, we have programs running in Pakistan and Bangladesh and Nepal, and we can use them. And they were very happy, except that they wouldn't, like they would be happy to give us all millions of masks. So they gave us 110 million, but they wouldn't lift a finger to actually get it to us. They're like, it's in a go down in like somewhere in Virginia. You need to come pick it up from trucks there and take it to like Savannah on a ship and then ship it to Dhaka. So ultimately, we did get 80 million, and it came just before Omicron hit. So it all worked out. But then I was trying to figure out, okay, how do I get shipping of 110 million masks to Pakistan and Bangladesh? We didn't get them to Chittagong and Karachi port. So I had so Yale had received lots of money from FedEx, right? So I was like, oh, we know them. So I contacted our president and said that we're doing this, let's try to get the, so they were, and FedEx chair and Namki, maybe you guys would know better than me. Anyway, the guy who founded FedEx, so he just wrote a one-liner and copied his Dubai team, because Dubai apparently their Dubai office handles South Asia and Africa, and said, oh, help these people, okay? So then they got, that's their boss, and Fred Smith, that's his name. So that's their boss, so they got on the Zoom with me, right? And they were like, yeah, we're happy to help, right? So they were telling me that they have, twice weekly flight, or maybe a daily flight that goes from like Atlanta to Dubai. We can put it on, any excess capacity we have, we put it on there, and then we have a contract with Emirates, right? And they can take it to Dhaka or to Karachi. Okay? So I'm like, great, it was sounding really good, right? And then they're like, oh, how many masks? Okay? And then I told them the number, right? And the Hanes had given me the pallet sizes, right? So I gave it to them. So on Zoom, I see the logistics guy doing some calculations, and his face turns dark. He's like, oh, so that would be the equivalent of 15 Boeing 777s. No, we can't do that. So it turns out 15 Boeing 77 trips to Dubai from Atlanta, and then on Emirates, it's like a few $1 million, right? You'd rather just make the mask here. Okay? So I said, actually, that's not what I was thinking. I wasn't thinking you put on a Boeing 777. I was thinking that you're a logistics company, right? You can just put it on a ship, because I hear that lots of ships go to Asia empty, right? And they're like, no, we don't have shipping logistics, like we have other subcontractors we use. And in any case, the ships that go to or come back from the US empty is like the ones that go from China, like they take a lot of stuff and then they come back empty, so that doesn't work. So ultimately they didn't help, but Asif Bhai found a donor that said, we'll just pay for the shipping. Right? And then the mass arrived, and we distributed, like we distributed about 80 million masks just before Omicron hit, so just like 4 months ago. Okay. Oh yeah, this was the video, but I think it's not going to work. So he was actually, I really have to give him credit, right? I was complaining about the government here and there. So he was like really effective, right? And this is one slide, like from, this is from that event. There was one slide that he used, and he made the comment to everybody, look, we all always talk about evidence-based and et cetera. Like we have a model that works, and that norm model. We have the organizations with the experience to do it. We have the evidence, we have government buy-in, we have the partnerships. Now we just need to roll this out. So if we can't do it now, then whenever are we going to be able to solve this, right? And I think I have to give a lot of credit to Dr. Atiur Rahman for making that connection. And so within a month, it all took place. Okay, and then here's I should wrap up and just have you ask questions. So we took that rural model, we took it to Lahore, and the Lahore city government, they came up with lots of really cool innovations. Okay? Because in a city, to solve the problem of getting people to wear masks is fundamentally different from how you would solve it in a village. Right? Because the formation of social norms is very different. In a village, I care a lot about what people around me think. In a city, I really don't. I'm relatively anonymous. Right? And then in a village, you go door to door and you distribute masks. In a city, you don't need to. So this is actually an envelope, right? We put the information in as well as some masks, and this is just in the inauguration event. This is the health minister of Punjab. She was mailing the first envelope to the chief minister of Punjab. Right? That was, and then this is Captain Osman. He's the Lahore city commissioner. So he did a lot of work. He actually came on Channel 24 and he made a presentation on what they learned from the Bangladesh study and how they're adapting it and what new innovations they came through. So for example, like taking masks door to door is extremely expensive, right? And just using Pakistan Post to solve that problem saved us a lot of money. Right? So then, the idea was that you're doing some work in Bangladesh, you learn something, you take it to Pakistan, you learn something new, you take the innovation back, right? So that's how we were progressing across India, Nepal, Pakistan, Bangladesh. And then in Dhaka, we also did the DNCC mayor was fantastic in like really getting behind this. And before both Eid, both Eid al-Fitr and Eid al-Adha that year, right? We ended up distributing something, I guess that's 4 lakh masks. So especially at the transport hubs, to make sure that when people were gathering together in buses and ferries, etc., that everybody was masked at that time. Okay, all right. So now let me just finish with what the future is, right? So the evolution was early on. We needed to just think about evidence-based policy making for COVID period. Then we needed to think about masking and how to make that work and scale that up, right? But what now? Okay. I'm really ready for COVID to be done so I just can get back to my regular life and the real world of the work I normally do, right? But there's one step that's missing, and that's vaccine inequity, okay? Especially in Africa. So we had that problem in South Asia for a while. I think it's been largely addressed, but in Africa it's still a problem. So I came here 2 weeks ago. I was in Sierra Leone, so I was spending some time there trying to pilot different ideas on how to get people vaccinated. Because relative to Bangladesh, it's a much less population dense country, right? So people are actually quite remote. There are communities that are far away from every other community, and getting them vaccinated is difficult. Okay? So you see what's happening is, this is global vaccine coverage. Africa early on didn't have anything, and this is the only region that still does not. Right? Everybody else has made lots of progress in getting their population vaccinated. Okay? Now, so here's how the politics is playing out. Okay? So there are, of course, complaints from African scholars, Africa CDC, et cetera, that this is just unethical what's going on, right? Where the US is giving more booster doses, let's say 6 months ago, than Africans were getting even first doses. Right? So effectively, their argument was the rich countries and pharmaceutical companies are withholding vaccines from us. Okay? Even though there was a commitment by the COVAX facility to get vaccines to every country. And that happened to Bangladesh too. We did not receive our quota, and prior to that, we had a contract with SII, Serum Institute of India, and then the Indian government put in an export ban on vaccines. So suddenly, even though we had paid for it, we did not receive the doses in time, right? And even though the Indian government had absolutely no claim to the intellectual property that was contained in the AstraZeneca vaccine, they didn't invest 1 cent in it, right? And so they started treating it like their national property, which it wasn't. So anyway, so African countries are complaining that, look, there are international supply chain failures, vaccines are being withheld. Okay? Now, what do the pharmaceutical companies in rich countries say? They're like, no, that's not the issue. We're not prioritizing that because vaccine hesitancy is so high in various African countries that it's a waste. Like you send vaccines there, they expire, and nobody uses them. Okay? So then the first thing I did was, okay, let's collect that data. Is that actually true? Right? So we went and studied in 15 different countries. We studied vaccine acceptance, right? So 13 low and middle income countries, many in Africa, but also like Nepal, Pakistan, but also in Latin America, like Colombia. Okay? But Rwanda, Sierra Leone, Nigeria, et cetera, et cetera. And as a benchmark, as a comparison point, outside those 13, we collected that same data in the United States and Russia. And what's the finding? Every single low middle income country we studied, vaccine acceptance was higher than in the US. Right? Not even one was it lower than the US. Okay? The only one that came close was Pakistan. Vaccine hesitancy is relatively low, but that's also the US's fault. This was a vaccine ruse they used where they collected blood samples, right, under the guise of vaccinating people, and then it came out that that's what they were doing. Right? That's led to mistrust of health systems since then. Okay, so that's like on the face of it from the data, this claim that vaccine hesitancy is very high in Africa, that just doesn't seem right. Okay? But there are stories that vaccines aren't getting used properly. So what is the problem? So this is the type of problem we have. So this is a picture I took in rural Sierra Leone, right? Getting out to remote rural areas with vaccines is not easy. Okay? So what happens is that you have people, so in our data, the average distance to the nearest vaccination center in our sample is about 3.5 hours each way in a vehicle, if you had access to a vehicle. Okay? And many people don't, right? And the average cost was about $6.50 each way. Okay? So we're talking about $13, just the travel cost, in a country where those rural populations, most of them live at around $1.50 a day. Right? So imagine asking you to go get a vaccine that would cost 2 weeks of your wages, half a month of salary. Right? People aren't vaccine hesitant, but they're not that vaccine eager either. Right? They're more like vaccine indifferent. Okay? If you go and take it to them, they'll take it. Right? So then why is it that say Borla, the CEO of Pfizer, is claiming they're vaccine hesitant? It looks like they're vaccine hesitant because people aren't coming, but it's because there's internal distribution challenges within those countries. Right? And the thing is that if you don't give them doses, right, people don't have an opportunity to experiment and actually build that infrastructure. Okay? So that's what we're now doing. So this is what I'm doing in Sierra Leone. So we basically put vaccines in coolers in the back of motorbikes, right, that we take out to the remote areas. And in the back of motorbikes, we have nurses. Okay? So people who are skilled at administering the doses along with the vaccines. And then we pair it with some community mobilization. So before we bring the vaccines, we hold village meetings, right? And also this is a case of a leader just like doing some miking for us. Okay? and get the leaders prepared and then get the community prepared যে আমরা ভ্যাকসিন নিয়ে আসবো, সবাই এই দিন এই সময় এই গাছের তলায় বসে সবাই ভ্যাকসিন নিতে পারবে. So once we do that and we prepare the communities, then people show up, hopefully all together, so it's very cost effective. We can quickly vaccinate people and leave, right? So the piloting I was doing 2 weeks ago, these results are not published yet. So in the small pilots we did, we were able to get in about 48 hours of these activities per community. We were able to move vaccination rate from 2 to 3% at baseline. It's like one guy who might have gone to the market, or a couple of guys might have gotten a vaccine. And after 48 hours, it was at between 40 and 55%. Right? So the pilot looks really promising. So what's happening right now is that before Ramadan starts, or Ramadan starts, we have to get this done because people in Sierra Leone aren't going to take vaccines while they're fasting. So the idea is, like we did for masks, let's do that trial, show that you can cost effectively get people vaccinated, so it takes away the excuse that the pharmaceutical companies are giving, right, for not withholding or not prioritizing the vaccine deliveries, right? So we're just trying to change the narrative so that more doses go, and the thing is that once the doses go in, right, that's when governments can use it to start experimenting with various strategies to get vaccines out to people, right? But without doses, for political reasons, they don't want to do it, because if you start generating demand but the vaccine doses don't arrive, then people get frustrated, right? And if voters are frustrated, that's not a good thing. So let me stop there. So that was a very long story, but it's been a very long pandemic. Okay? And I hope, the point of telling the story this way is that I hope you picked up some nuggets as to when we fail with respect to changing people's minds or trying to get policymakers to do something differently, and when we might have better success. Okay? So I learned a lot in the last couple of years, because normally I don't work with policymakers that much. I'm a researcher. I try to generate new data, right? And new insights. But in the middle of the pandemic, we just had to change how we do our business. Well, sure.
Thank you so much, Professor.
Thank you.
So now I guess the more important part from your perspective, you get to question Professor Mushfiq on what you have heard, and also যেগুলো আমরা শুনে যাচ্ছি কোভিড নিয়ে হতে পারে or any other policy. Professor Mushfiq has worked on agricultural technology, taxation, and many other stuff. So the floor is for you guys. আমাদের volunteer আছে এখানে, হাত তুললে ওরা মাইক নিয়ে যাবে. So I'm already seeing hands. So YPF volunteers, do you want to use this one?
হ্যাঁ, আমরা এখানে একটা রাখি আর ওরা একটা রাখি.
Hello sir, my name is Aura. Before I ask my question, I want to give a context to my question. So, যখন initially lockdown শুরু হয় বাংলাদেশে, তখন আমরা দেখি যে যেমন আপনি বলেছেন যে অনেকে তাদের লাইভলিহুড হারিয়ে ফেলেছে, তারপর যেহেতু ঢাকায় যারা বেসিক্যালি থাকে, যারা হচ্ছে কি মাইগ্রেট করে আসে ঢাকায়, তাদের পক্ষে ঢাকায় লিভিং কস্টটা অনেক হাই, তাদের কাছে বেরকম কষ্ট না, স্পেশালি যদি হচ্ছে গিয়ে চাকরি অফিস সব বন্ধ থাকে, তখন তাদের পক্ষে সম্ভব না। তো ওই সময়টা আমরা একটা ব্যাকওয়ার্ড মাইগ্রেশন দেখি, ব্যাকওয়ার্ড ইন্টারনাল মাইগ্রেশন। কিন্তু যখন লকডাউন উঠে যায়, তারপর পরে আমরা ইনফ্লেশন দেখতে পাই। তো ওখানে হচ্ছে পরে আবার হচ্ছে যারা মাইগ্রেট করে চলে গিয়েছিল, তারা আবার হচ্ছে গিয়ে শহরমুখী, মানে শহর কেন্দ্রিক মাইগ্রেশন শুরু হয়। তো আমার হচ্ছে কি আমি যেটা রিসার্চ করতে চাই, হচ্ছে আমি জানতে চাই যে কোভিডের কারণে কি ইন্টারনাল মাইগ্রেশনের যে ট্রেন্ড, আমাদের খুবই সিগনিফিকেন্ট একটা চেঞ্জ এসেছে, আর এই চেঞ্জটার সাথে কোপ আপ করার জন্য বিশেষ করে আরবান ইকোনমিতে কি যথেষ্ট ইফেক্টিভ পলিসি আছে এই নতুন মাইগ্রেন্টদেরকে আরবান ইকোনমির সাথে ইনকর্পোরেট করার জন্য। তো কিন্তু এটার জন্য যেটা আগে দরকার সেটা হচ্ছে জানা যে চেঞ্জটা কি সিগনিফিকেন্ট ইনাফ কিনা, মানে চেঞ্জটা কি হায়ার ইনাফ কিনা চেঞ্জ আনার জন্য। তো আমি হচ্ছে রিসার্চের জন্য কি ধরনের এভিডেন্স কালেক্ট করার প্রয়োজন, এটা হচ্ছে আপনার কাছে জানতে চাচ্ছি। এটা আমার প্রশ্ন।
Okay, very good question. And I would just broaden your area of inquiry to both internal as well as international migrants. Right? International migrants are also very important for our economy, as are internal migrants. And trying to understand, what exactly happened, when COVID hit, say the Middle East or Italy, where a lot of migrants sent back to Bangladesh, right? Did we have to absorb them in the local labor market, or were they able to easily go back? Right? We need to understand those things as well. And the questions you already posed, you know, I suspect that, you know, there was a lot of job separation, like during COVID, right? And then the question we want to ask is, okay, were those job separations permanent, or like did people have to start from scratch, or were they able to just reattach themselves to the jobs that they had pre-COVID, or are there challenges that we need to address, right? So I think there is no alternative but to collect data directly. So that's my short answer, which is, you know, rather than theorize about what's happening, right? You know, let's talk to some migrants. Let's figure out exactly what their experience has been like. But you also want to get representative information, right? So I think you need to do this in somewhat large sample. Okay? Sure.
To NAMA institution type of
Okay then. The request was just introduce yourself. NAMA institution.
I'm Mohammad Mahilism from Bangladesh University of Professionals. And my question is, like, after like the entire session, which was really lovely by the way, what are the advices that you would love to give to the youth? Because at the end of the day, like, for someone like me, who's just starting out, we are just clueless, right? So we don't have any ideas, we are starting, we just want to understand where we can start.
Good.
So what are your advices for that?
Yeah. My first piece of advice is don't call yourself clueless, because you're not. And something I learned during the pandemic is that we have an enormous wealth of talent in this country, right? So I was able to connect through, say, YPF. I was able to connect to economists who are working around the world, who are of Bangladeshi origin, right? But I was also able to connect to other people, other sectors, people working in other sectors that I had no idea. So for example, people who are working in data science, right? Or in public health, right? And we have a lot of talent from the country that are বিভিন্ন দেশে ছড়াই ছিটায় আছে, আমার দেশেও আছে. And you know, one of the, you know, I guess what I learned was, you know, we need to leverage that talent better, right? We need to create more connections. And this is why I love YPF, and I've been an advisor from inception. Okay? That, you know, there's like making these connections, forming these teams, right? That itself is another really important piece of the puzzle. Okay? So my advice would be, yes, you do have talent. You just have to introspect and figure out what that is, right? You're not clueless, right? But you're going to be a lot more effective when you connect with people with complementary skills, right? And so figure out like how to build teams, how to work with others. In fact, that's what I tell my children, you know, that it's not possible to be successful by, like for example, I spoke about a lot of work. Like I didn't have the time to denote everybody who was working on it, but there were literally dozens of people who contributed to all these things, and they come from many different sectors. And some of them are very young.
Thanks for giving me the floor. This is Abdul from Bangladesh University of Professionals, and I'm also an ex-Josephite. That's something I'm proud to have in common with you. The first thing that I want to ask, I have two questions here. The first question is about the lecture. One of the terms that I particularly noticed and admired was the frugal innovation, something that Bangladesh had evolved from Sierra Leone, which being growing countries in both cases. Now, my question is, in case of the post-pandemic period, what can be the frugal innovation strategy and the policies that can be implemented in case of the growing economies? My second question is based on the evidence-based policy regarding wearing masks, where the statistics were given high priority. A local community was suggested to wear masks, and then the graph was noticed if it was in a rising scale, and it happened to be so. But what if a local community was tested without wearing masks in between this pandemic and the graph was tested in contrast? How can we tell that it is a very reliable policy until we test the contrast effect of that? Thank you.
Okay. If I might have misunderstood the question, but based on what I understood, on On the second question, right? Inference is complicated. Statistical inference is complicated. Like I gave a simple example where during COVID, food insecurity was actually lower than 6 months prior, right? So if I just draw that trend line, I would get exactly the wrong answer, right? Therefore, you should always be careful about just drawing trend lines, right? And that's why, the reason why we had to collect data from 350,000 people, right? And conduct a randomized control trial is because, you know, when we apply these complicated or sophisticated methods for statistical inference, we don't do it because we want to be sophisticated for the sake of being sophisticated. We do it because it's actually necessary, right? You can go wrong by not thinking about the control group correctly. What is the counterfactual, right? And okay, so let me just end with just the definition of a counterfactual, which is something you should always have in mind, which is, right, let's say I get you to wear a mask. Tumhar naam kya bolo?
Sadat al-Abrar, Sadat.
Sadat, okay. So basically, let's say I get Sadat to wear a mask, right? And is that effective for you? Is that working for you? The only way I would know, right, is to know if Sadat wearing a mask has a lower infection transmission rate or transmission risk than Sadat without a mask, right? The problem is that I don't observe you in that parallel universe, right? I cannot observe Sadat both with a mask and without a mask, right? And since I cannot, then I need to be very careful in thinking about how do I approximate that counterfactual, right? And all of the statistical stuff, I mean, I didn't go into the methodological details today, was all about constructing counterfactuals, and trend lines are typically not very good counterfactuals.
Thus, we can see that the evidences are basically based on statistics. They are not based on organic experiments or what can we say based on factual stuff.
No.
They're actually based on statistics.
I'm not sure what distinction you're drawing between factual stuff and statistics, because I'm not sure that those are different words.
Because
Right?
if there is a health concern, for
Yeah.
example, we are researching how masks can actually prevent the spread of COVID. And regarding the logics, we are telling people that you have to wear it. And then we are talking to people that, look, these are the statistics. A lot of people have benefited from this, and that means you will also benefit from it.
Okay,
So
no. No, actually, that's not correct. That's not the evidence base. The evidence base is the following. So there's a field trial that I talked about, but prior to that, there are lab trials. Okay, trials of the form where I put a mask or the piece of fabric, right, in between approximating what a sneeze is, right, and some recipient over there, and there's a lot of data that shows that, you know, the transmission risk is lower depending on whether you have 2 pieces of fabric for 2 people versus 1 or not. You will have seen some of the data as well. So in any field of science, there's both theory as well as empirics, right? So what I showed was the downstream empirics, right? Because we had these lab trials. I mean, I'm not going into detail, but many such lab trials. We also had what you might be calling organic data, which is I can look at transmission risk after the pandemic in South Korea, where mask wearing was common, versus the United States, where it wasn't, right? That's another type of data. Even after all of that data was made available, the WHO said, nah, I still don't feel comfortable recommending masks because we're not sure. Why not? Because in a field setting like we did in Bangladesh, right, we just don't have that information. Just because in a lab a piece of fabric blocks particles doesn't mean that in the field it will, just because maybe people wear a mask but they wear it down here, right? Right? That's not a surprising thing for anybody, right? So then maybe it doesn't work, okay? So that's why we have to do a field trial, and that's why the accumulation of all that evidence led them to ultimately change their guidance. Okay? The evidence generation was very complicated. And as to your first question about what are the frugal innovations,
what are the frugal innovation strategies that we can follow in post-pandemic era?
yeah, I'm not sure. I don't know. I would have to think more about it. Exactly what is the post-pandemic problem that we need to prioritize right now, and what are the innovations that are necessary. And the reason I'm not comfortable pontificating without thinking through it is that I need to first think carefully, collect data or inspect data, and only then can I answer that question, right? So maybe in about 6 months, after I'm done with vaccines, I'll think about it. Yeah.
Sure.
So, আর একটা জিনিস স্যার এক্স জোসেফাই বলে কিন্তু কিছু লাগে মনস্টার জোসেফাই হবে
Hello, sir. I'm Salman Tariq. I'm a freshman in Monster University, and I also have to be Josephite.
Okay.
So my question is, there are certain oppositions and resistance when you introduce a policy and when you want to enact a law. That can be local, religious. I'm talking about the radical part, or even political. For example, in the U.S., mask was heavily politicized by President Bush administration. So my question is, how do you address such resistance and effectively basically ensure that everyone is abiding the law and you're getting the results? Apart from the sanctions and legal perspectives are already there. So what can be done? What else can be done to ensure that people are actually abiding the law and really getting the results? Thank you.
Yeah, okay, so from this research, I'll just say two things. One, very specific to the case that you're mentioning about masks, and one more general. The specific thing is what we learned from this research is social norms are important drivers of behavior. Okay? So people wear masks when they observe other people around them wearing it, and it feels bad to not have a mask on. And in fact, this is the type of thing that, Khairul Bhai is here. We worked on sanitation in the past in North Bengal, right? Where social norms are also extremely important drivers of behavior, where people are more likely to invest in a toilet if other people around them stop open defecating. Right? And okay, how do we know this? So separate from my data, right? Here's something I noticed. So in February 2020, right? If I was wearing a mask where I live in Connecticut in the United States, right? People would look at me funny, like, what's wrong with this person? Maybe he has some disease, right? It's just strange that he's wearing a mask, okay? And then in February 2021, in that exact same community, same neighborhood, if I walked around without a mask, people would look at me funny and say, what's wrong with this person? Why is he not wearing a mask? This is just like socially really unacceptable, right? So, and social norm drive behavior. So basically in February 2021, regardless of my own risk perception, right? Because I would lose friends if I went around wearing a mask, or people would view me as being irresponsible, right? Even if I didn't want to, I had to wear a mask. Okay? So norms are extremely important.
You're talking about peer pressure, right?
Yeah, exactly. So that's what social norm is. So social norms can be negative and based on peer pressure, but it could also be positive, right? Which is we aspire to the behavior of others. Okay? Now, the more general point about, okay, when it's politicized, how do you deal with that? I think, that's not just around masks. Everything is now politicized where, the levels of disagreement and polarization is extremely high. And I see that, in the US is a problem, but all over the world, right? I think we really need to learn how to start talking to each other again, right? And not, and I think the problem is both from people on the political right and the political left, right? Where we're all trying to one-up each other and trying to prove how smart we are by putting somebody else down. And I wish we'd take a step back.
Thank you. আচ্ছা আমরা এখন প্রশ্নগুলো একটু ছোট করি হ্যাঁ because we are running out of time.
আসসালামু আলাইকুম, আমি সালমান বিন হাসান, বর্তমানে পড়াশোনা করছি ঢাকা বিশ্ববিদ্যালয়ে আন্তর্জাতিক সম্পর্ক বিভাগে। আমার প্রশ্নটিও কোভিড রিলেটেড কিন্তু কোভিডের শুরুতে বাংলাদেশ সরকারে দেখা যায় যে বাংলাদেশের আইটি সেক্টরে প্রথম একটা বিশাল
Can you speak without the mic? Echo জন শুনতে পাচ্ছি না। Just and I'll repeat the question so everybody else can hear.
দেখা যায় যে কোভিড যখন শুরু হয়, বাংলাদেশের সরকার তার যে আরএনডি সেক্টরের উপর একটা মেজর হিট তাকে রিভাইভ করার জন্য অনেক ইকোনমিক ইনসেন্টিভ অফার করে, এটাকে স্টিমুলাস প্যাকেজের নামে অনেক কিছু দেওয়া হয়। এবং ইফ আই রিমেম্বার কারেক্টলি বাংলাদেশের বাজেটের প্রায় 1/6 অংশ গিয়ে এই মনিটারি সামটা আর কি ইনহেরিট করে। তো গিয়ে যখন এটা চলে গেছে, কিন্তু এখনো কি সেই লোনসগুলো কিন্তু গার্মেন্টসগুলো পে করেনি, এবং একটা লিকুইড ক্যাশ কিন্তু বাংলাদেশের মার্কেটে চলে আসছে, যেটা কি আসলে ব্যাংকের কাছ থেকে নিয়ে দেওয়া হচ্ছে কিন্তু দেওয়া হয় নাই। আর রিসেন্টলি একটা জিনিস দেখা যাচ্ছে যে ডলারের এগেইনস্টে বাংলাদেশের প্রাইস, টাকার প্রাইসটা নেমে যাচ্ছে, আমাদের দ্রব্যমূল্যের বাজারে একটা প্রাইস হাইক দেখা যাচ্ছে। তো আমার কাছে একটা কারণ হিসেবে, অনেক কারণই আছে, কিন্তু আমার কাছে একটা কারণ হিসেবে মনে হয় যে এই যে লিকুইড ক্যাশটা সাডেনলি আমাদের মার্কেটে চলে আসলো, যেটার এগেইনস্টে আসলে রিসোর্সটা কি আমার কাছে লিমিটেড, এটার কারণেও প্রাইস হাইকটা একটা কারণ হিসেবে দাঁড়াতে পারে। So does this seem to you as an evidence to this price hike, and if so, what could be the policies or the policy gaps that led to it, and what could be the policies that can tackle it?
Okay. Oh, that's a really complicated question, and I'm going to be careful about what I say because I might get it wrong. Yeah, I do think that like the general problem you're talking about, which is non-repayment of loans, that's a long-standing problem. That's not a COVID period issue, right? In fact, the problem was probably even worse in past years. And yes, if there was a massive injection of cash in the economy, that is going to put inflationary pressures, right? And if you do get repayment and it goes back into the banking system, I think that would be the right strategy. So I think the answer is, I'm not sure that this is a feasible, practical answer, but the answer is yes, you need to enforce repayment, which is important for the banking system health, but it's also important for the credit market reputation in the country, but I think it also addresses the specific policy issue you're talking about. Right?
Yeah, good afternoon. Mr. Bhai, we're connected on Facebook. Finally, we're meeting. I'm Maya Chaudhary. I work with water technology and water management. So my question is, I can't see him.
Oh.
Okay, so my question is, you have been doing outstanding work, and I know we have been in touch with how things were working and how we were collecting very good data and everything. To stop, or what would BRAC do, or the government should do, since people are throwing away masks? Because this is a huge thing. We're seeing masks being discarded everywhere.
No.
So what would be your suggestion, since you have been working with this for such a long time? Because it has been working with the environment, so this has become such a concern. And we have been finding it everywhere, even in estuaries and even unthinkable places where we have to really employ people to collect them.
Yeah.
So what would be your suggestion? Because we have to come back to the circular thing. Ensuring that it doesn't damage the environment. Thank you.
Yeah, great point. Everybody's asking really difficult questions today. So it is, I'll just accentuate underline the problem, which is that the mass that we're talking about here, right? It's actually not easily disposable or recyclable either because it has plastic components, right? And we thought carefully about it in designing the mass, and that was necessary for the mass to last and for us to have produce it cost effectively. And at that point we thought carefully about, okay, look, there is definitely some environmental ramifications of promoting mass in such big ways. Is it worth it? We did cost benefit analysis thinking through, we have data on changes in transmission rates, and it was still worthwhile. Even given the environmental cost, it was a sensible public health policy even then, right? But you're absolutely right. Right now we need to think about how to reduce the amount of waste that's being emitted into the environment. So one strategy maybe we want to try piloting is having a program where we pay little bits of money for masks that are returned to us so that it can be safely disposed, right? And earlier we were talking about other economic dimensions of the problem, so people still need support, right? So why not provide that economic support in exchange for an action that has environmental benefits as well, right? Yeah. So actually, yeah, it sounds like you would be in a great position to do it, and I'd be very, very happy to support it. Yeah, I think that we should be trying this out. If there are indeed thousands of masks or hundreds of thousands of masks out in the environment, right? Maybe we can have a buyback program. Right?
Is there any way to push the policymaker?
If there's a way to push.
The policymaker to enforce your policy. So, for example, whenever you're going for suggesting something, that's they will not do it as if it's not going to their country.
Yeah.
For example, যখন lockdown দেওয়া হলো, garments accept garments because of more than 50% parliamentary are garments business.
Right. Yeah, I agree. I don't think we're in a position to always just tell policymakers, you do this, and they're like, oh yeah, I was just sitting at my desk waiting for you to come and tell me what I need to do, and now I'm going to do it, right? So policy change is a complicated process. It doesn't happen in one day. It doesn't happen with one conversation, right? And that's why, like for example, that day, the story I was telling you with a 3-hour meeting, if Atir Rahman Bhai did not go after the finance secretary and completely change the tenor of the conversation, that might have been a complete disaster. I might not be here presenting anything, but I would have nothing to present. Okay? And so we need to be, so policy change, trying to encourage movements in the positive directions, right? There's probably a complicated science to that as well, right? And force করে কিছু এখন পর্যন্ত maybe other people are more capable than I am. I have not been able to force a policymaker into doing anything ever. Right? That's not how it works, at least in my experience. Yeah. So I think instead we have to think about, for policy change, there's a science to it. We have to have a strategy for it, right? And the strategy involves, like any strategy, let's identify who are likely supporters. Let's empower them with better information so that they can get their message out. Let's identify who are people who are going to stand against it, what their incentives are. Can we figure out a way to address their concerns, right? So I think it requires strategic thinking, just like Russia and Ukraine are currently engaged in strategic thinking. It's the same type of problem. There's a lot of game theory there.
Hi, my name is Samir Bhuya. I'm in the 10th grade. I go to the current setting school. I have one question for you. If we are to find a group of translators between evidence finders and evidence users, what would be a good way for these said translators to understand the constraints that evidence users have?
Good. Yeah. So I think the single most important characteristic of a person who would do that job well is empathy. Okay? So it's, so for example, the way that you were talking about, how do we force policymakers, right? We're taking a view, the policymakers are there as our enemy, right? And they're getting in the way, and we need to either go around them or force them, right? Yeah, it might be true. Maybe there are some policymakers who have that characteristic, but like viewing them that way is not helpful, right? We're not ever going to be able to get anywhere, right? Instead, we have to think about empathy. What's empathy? Right? Okay, so this guy has a job. He's probably busy. He has to think about lots of things. So let's think about, what is it that keeps him up at night? Why is it that it's difficult for him to act? Okay? And that might be, some of that reason might be selfish for him, right? That, he needs to just think about how to generate extra revenues from his job, or he needs to think about how do I get promoted, right? How do I get reelected? But for us to be successful, we really do need to understand what is their objective function. Okay? So I would say the first step is understanding whose behavior you're trying to change, understanding that person and what their preferences are, what their constraints are, right? And then think about, what action can I take such that something positive will happen that accounts for the fact that they are constrained and they have certain preferences. Okay? Empathy.
Thank you so much, and thanks to you guys. So YPF থেকে আমরা প্রফেসরকে ফর্মালি ভোট অফ থ্যাঙ্কস দিয়েছেন, সেটার জন্য আমি স্টেজ আমন্ত্রণ করছি সাদ আব্দুল্লাহ, দ্য হেড অফ ইনোভেশন ফর YPF.
Thank you everyone for coming. That brings us to the end for today's policy masterclass. সবাইকে অনেক ধন্যবাদ। আপনার একটা ওয়ার্কিং ডেতে এরকম ট্রাফিকের মাঝখান থেকে কাজটা ছেড়ে দিয়ে আপনি আসছেন। And I really hope আপনারা আজকের সেশন থেকে অনেক কিছু শিখতে পেরেছেন। Big round of applause for Moshik bhai again.
Thank you.
স্যার আপনারা আমাদের মাঝে এখানে আছে, তো ওনার জন্য একটা round of applause. So সবাইকে thank you, and we look forward to seeing you again. Thank you.
Thank you. Oh, this is lovely. Thank you.
সেম টাইম আমরা ওভারকে মোল্লা স্যারকেও
See, that's a great start. Thinking about what's important to me, that my father is here, making him feel good as well, right? That's how you change hearts and minds. Now, let's start with this. আমরা সবাই এখানে যাই, এখান থেকে একটা ছবি তুলি, তারপর যদি জায়গা হয় এখানে আসবো, কারণ at least everybody's here, so let's do the other way around. We can try both. They can ask the সবাই